Well, welcome, folks. Here we are once again at Core Brain Journal, and we have a very interesting guest today. You know, what we try to do in Core Brain Journal is stay ahead of the curve in terms of interventions, systems that can make a difference in people's lives. And yeah, we get a little bit out of the box, but I think when we really do the measurements, we're really so far in the box that it looks like we're out of the box. And today we have a terrific guest, Rick Malter, Dr. Rick Malter, who's down in, get this, Cottonwood, Arizona, and he's going to join us on Skype. And what we're going to do is talk about his interest in, get this, hair analysis, mineral analysis, and correcting underlying mineral deficiencies and excesses that can cause significant brain problems. Welcome, Rick. I look forward to talking to you.
Well, it's a pleasure to be with you, Charles. And I always love talking about my own story, about how I got into hair analysis. I'm a psychologist. I was both a clinical and a school psychologist in Illinois for most of my career. And it was through my work as a school psychologist doing psychological testing of kids who had learning disabilities of various types, developmental delays, and what then started to be called ADD. So I was the psychologist in an outpatient clinic made up of an optometrist, a PhD educator. They asked me to be the psychologist. And the PhD educator noted how burned out and exhausted and sickly I was 36 years ago. So he suggested that I get a hair analysis. So he gets the hair analysis, he's looking at the results, and he puts his thumb and forefinger close together, and he looks me in the eye and he says, "Rick, you are this close to a heart attack." Well, I knew something was wrong with me because my fasting blood sugar in a glucose tolerance test was 45, shot up to the 160s, and at the end of the 6 hours came crashing down to 35. Needless to say, I did not feel well during that glucose tolerance test. And I learned quickly about reactive hypoglycemia.
Well, Rick, it was interesting that you happened to fall into somebody who had that knowledge 36 years ago, because even today, it's just something that people think it's like snake oil. It's out there, and people are doing weird tests, and what does it mean? I think the thing that's really interesting about a person like you, David Watts, the people who know the science, is how predictable these measurements can make treatment strategies.
Exactly. And one of the things that Dr. Watts and his colleague, the late Dr. Paul Eck, in their research, they began in 1975. And they just uncovered a whole system to interpret the mineral patterns in the hair. And what they learned very quickly was the minerals don't deposit randomly in the hair follicles. They deposit in very distinct patterns that can either be designated a fast metabolic type person or a slow metabolic type person. And these reflect different parts of the nervous system. The sympathetic nervous system usually is associated with the high sodium of a fast metabolic type. And the parasympathetic is associated with the adrenal insufficiency or adrenal burnout of the slow type. And these patterns are just so consistent because the mineral deposits in the hair follicle are driven by the autonomic nervous system, sympathetic and parasympathetic, and also by the endocrine glands, primarily adrenal and thyroid.
So let's take a moment to pause on this, because I know we're already over the heads of some of our listeners, okay?
Okay.
So one of the things we want to talk about is let's break down sympathetic, parasympathetic, just in terms of brain function patterns. What kind of people are more sympathetic and what kind of people are more parasympathetic?
Okay. The sympathetic are like me. Very, very fast metabolic types. Type A personalities. Usually have very, very strong adrenal gland reactions to stress. We have a short fuse, low frustration tolerance, the slightest irritation or frustration, and we can blow in an instant.
So So when you say adrenal gland, just for our listeners, fight, flight, or fright, boom, there's going to be some action because that gland is overactive on a sympathetic dominant person.
That's right. And there are strong emotional connections to the adrenal gland reactions, the fight or flight. Fight is closely associated with anger and, in extreme cases, rage, whereas flight is closely associated with anxiety, panic attacks, and, in extreme cases, feelings of terror. It's that simple. And it's all related to stress. And I would venture to say, and I've said this on my blog, on my webpage, that many of the behavior and emotional and relationship problems that most people have are related to what I call stress overwhelm. Their systems don't handle stress well. If they're an extreme fast metabolic type with strong adrenal gland reactions like I have, then they have very, very quick trigger reactions. And they either blow with anger and rage or they go into anxiety and panic. On the other hand, the slow metabolic type usually is so burned out and so depleted, they can't even mount a good adrenal gland response to stress. So they withdraw because the slightest irritation or stimulation just overwhelms them.
Well, you know, it's funny because we actually started talking before I actually introduced you, and I want to apologize to you and our listeners because we were talking before we even started, and I enjoyed talking to you so much, and I feel like I know you. And I'm just going to take a minute to tell our listeners, this guy that I'm talking to here down in Arizona is an expert in tissue mineral analysis from hair, and I think the point that I did want to raise, and we just dove right into it here, is he's written a book called Strands of Health, and it was written in 2003. And I've had this book for many years and use tissue mineral analysis in my practice for recalcitrant. We don't do it routinely with everybody, but we do it with individuals who just aren't getting well with traditional care. They should turn around easily. It looks easy, and it really isn't. And as a result of that, we got more into looking at different testing protocols. And it's one of the reasons I'm really pleased to be talking to you, Rick. So we'll have to pull our thing back and start going down the road a little further with this particular case. You were really talking about yourself.
Yeah.
You're a guy who was, in a way, lost.
I was in a stress burnout. I thought I was dying 36 years ago. I'm going to be 80 next January, and I got 1,000% more energy than I had 36 years ago when I was 43.
So then let's tell the audience, we talked a little bit about it beforehand, but down at 45 on your blood sugar, fasting blood sugar, what was the underlying trace element problem that contributed to that, and how did you set out to fix it years ago?
Okay. My first hair analysis that was obtained by our PhD educator in our outpatient child development clinic, he got the hair analysis and he found that my magnesium was 0.9 milligrams percent. The ideal magnesium is 6 milligrams percent. So my magnesium was 90% too low. Magnesium helps regulate insulin and blood sugar. When you're deficient like I was, your system's flooded with insulin and it crashes the blood sugar, in my case, down to 45. But magnesium also helps regulate muscle relaxation, and also helps regulate the heart rhythm. So my friend was very concerned, not just about my low blood sugar, but that I could have one of these sudden, massive, fatal heart attacks. So he really got my attention, and I've been taking magnesium now for the past 36 years, and my heart is still beating very nicely in a good rhythm.
Did you notice any other physical symptoms back then when you were a kid? Besides being tired, you mentioned that. Did you feel like you had any of those muscle, heart, irregular symptoms going on.
My mind was in such a fog, I didn't even have the awareness of what was happening to me physically. And I had a big red growth on my forehead. And the chief of dermatology at the University of Illinois Medical Center was convinced it was a malignancy. So he had his chief resident take a couple chunks out of it. They sent it down to pathology. Each time it came back non-malignant. So they kept taking chunks out of it, hoping that they'll strike gold or oil.
They wanted to take care of you. They were going to make something happen.
I'm relieved that it's not malignant. But anyway, that was also one of the, I'm sure one of the adverse effects of having such a severe magnesium deficiency. And so here I am 36 years later, and I attribute my survival and my recovery of health, energy, and vitality to the hair analysis and to magnesium and other nutrients.
Now, one of the reasons I got into it, Rick, and I'll tell you real quickly, is I had a adolescent girl come in who I was treating her. She had ADD, she had depression, and she was a senior in high school, a cute cheerleader girl. And we were trying to figure out what was going on with her, and she came in. The medications that I was giving her were failing. And one day she came in. Of course, her mother was in there for every meeting because we were simply doing med checks. We weren't doing therapy. And she said, you know, Dr. Park, I've got to tell you something. I'm actually been thinking of killing myself every day. And I didn't want to tell you because I knew you were really trying to help me out. And then she took a deep breath and she said, and I got to tell you, I've been hearing voices as well. I don't think I'm crazy, but I'm hearing stuff that isn't there. So we backed up a little bit. I was, of course, in shock because she looked like she was upset and depressed, but I didn't think she was having psychotic symptoms or suicidal thoughts. And the ultimate point of the whole thing was there was a person in town who said, look, they were a functional medicine person. They did a hair analysis on her, and she came back with her copper out the roof.
Of course.
You know, and
she's a classic example of a high copper.
Tell us a little more about that, because that was a turnaround point in my career when I realized that. Please tell us a little bit about copper and that symptom picture.
Okay, well, copper is known to be correlated with estrogen. And so what happens with a lot of these teenage girls, as their hormones come in and develop and build up, if they're estrogen dominant, they build high copper levels. And high copper loads in the liver, but it also loads in the brain and can produce a lot of symptoms that will be very much like ADD symptoms: concentration and memory, racing thoughts, distracting thoughts, inability to focus. And in certain individuals, eventually it can build up to a point where they do get suicidal thoughts and where they do start hearing voices.
Well, in that particular person, and tell me this because you've had much more experience than I've had with it, the copper itself can raise the estrogen level then. Is that not correct?
Yeah, it's reciprocal.
Yeah.
The relationship between copper and estrogen is reciprocal.
So then she was having problems with her periods, which we ultimately discovered. She was having estrogen dominance, even though she didn't look like she was estrogen dominant.
Yep.
I mean, she had no signs of polycystic ovarian or acne on her face or...
No, it hadn't reached that point yet. Mm-hmm. But it certainly sounds like it impacted her psychological functioning, her thinking and her concentration and her moods.
Yes, it did.
And you can bet that 99% of teenage girls with various kinds of psychological and relationship problems and behavior problems are going to be copper toxic today.
Now let's talk a little more. Sorry, what did you say, Rick?
It's an epidemic.
It is an epidemic because we see it often. We do a lot more testing than we ever did because we see people who are treatment failures. I mean, the buzzword in our office is treatment failure. I mean, we see treatment failure. We know right at the outset that we have to dig deeper.
Hmm.
But before we actually got on recording, we were talking about copper and its relevance to a variety of other conditions and how that plays itself out in a psychiatric treatment scene.
Hmm.
Could you elaborate a little bit more on that if you don't mind?
Yeah, one of the first children that I did a hair analysis on in my office. This is back in 1983. We used to do screenings for learning disabilities and ADD at our office. So this mother brings her 9-year-old kid in, and he was one of the most extreme hyperactive kids I had ever encountered. And one of the things we did, besides my doing psychological testing, which was interesting because it showed he had a very, very high IQ level, but he had problems with auditory memory and processing, which is one of the major characteristics underlying a lot of ADD diagnoses. They can be very bright on a conceptual and language level, but they easily overload auditorily. A lot of times they have a history of ear infections, and they wind up with some impairments of their auditory processing. And that was one of my specialties in picking up on that. We had an excellent speech therapist who treated that. So we had the psych testing on this boy. And then we also got the hair analysis. And in his first hair analysis, it showed that he was a fast metabolic type child, low calcium and magnesium, high sodium and potassium, which contributed to a lot of his aggressiveness and impulsivity. But his copper level was extremely low. His copper was 0.8, the ideal copper is 2.5. So we put him on a supplement program, retested him in 3 months, and his copper had jumped from 0.8 all the way up to 24. That's what we call a copper dump from the cells and tissues, or a detox of all that excess copper. So as his system is releasing the excess copper, his mother is observing he's calming down.
Okay, Rick, let me stop you right there because this is an interesting point, but let's tease this apart a little bit for our listeners because things are going up and going down. Let's really try to catch this. So really, in his tissue mineral analysis, which is through his hair, which we're going to talk a little bit about how a person does that, just to be very elementary about it, but looked at his hair, he was very low in his hair on copper.
Right,
So
in the
then,
first...
and then did you then supplement him with copper?
No, wait a minute. Well, it's over 30 years now.
Oh yeah, but the issue is,
We
what I'm
pro-
really asking is, I understood the dump part.
We probably did supplement him with a little bit of copper, which then would have started to mobilize excess stored copper to help his system release all of the excess.
Yeah, we do see that. Now, I mean, one of the things that happens in our practice is if you use any zinc at all and a person's high in copper, it just mobilizes it.
It comes out.
And they can get sick, they can get exceedingly sick. It's almost like a Herxheimer reaction from Candida.
Mm-hmm.
It's just almost not manageable at times. You just have to start all over again.
Yeah, and over the years, I've learned to be very, very cautious because I've seen how quickly some individual system can respond to different supplements. And if they go into too heavy a detox, it overwhelms them, and it's too much too fast. Mm-hmm. So I've learned to go with a much lighter program. In fact, one of the things that I very often do with copper toxic individuals, usually they're deficient in magnesium and in potassium. So sometimes I will just start them with magnesium and potassium because those are the intracellular minerals that will support energy production in the mitochondria of the cells and give them an initial energy boost, which can be very encouraging. Oh, I'm not chronically fatigued. There's a way out of this. Mm-hmm. So the magnesium and potassium turned out to be a good place to start. And then we would just bring them along very slowly because I didn't want to blow them away with too heavy a dose of zinc and vitamin C and manganese to trigger a copper detox.
Well, and that brings us back to this point I was saying I would ask you about, because it's interesting. We use a Walsh protocol, and you and I were talking about Bill Walsh outside of Chicago. And incidentally, Rick, you'll be happy to know that I interviewed him for an hour. I've got several interviews with him coming up, not published yet, but they will have been published by the time yours comes out. But anyway, back to it. We do a lot of blood testing of copper, and found that the hair analysis of copper would be low, but the blood test would be high. And could you discuss that a little bit for our listeners, because it's paradoxical and doesn't make sense at first?
Well, because at the time that a particular hair analysis is done, the detox of the excess copper may just be starting, so that the hair hasn't picked up all of that serum copper yet.
I got you.
But if you do a quick retest in another month or two, you'll probably see a substantial jump in the hair copper level, like I saw in this little hyperactive 9-year-old that we were working with.
So then what happens is, when it starts mobilizing and moving around is when it actually comes out more to the hair. Otherwise, it could be picked up on a cellular level.
Right. Otherwise, it'll be locked in the cells. And when it's already starting to show in the blood, it's really starting to get mobilized. For detox, it'll be carried to the kidneys and out the urine, but then the hair picks it up, and you see the high copper levels. So when it comes to the hair analysis, we know that the mineral system that's shown in the hair analysis is a very interrelated system. The different minerals have close relationships to each other. As a matter of fact, even one nutrient, like zinc, for example, can start a cascade of changes in the rest of the mineral system.
Elaborate on that, because that's a very interesting point, because you're saying something very important right there.
Okay. So we know that zinc will antagonize copper. So if the person is copper toxic and you give them zinc, that can start a release of the excess copper that then is released from the liver, from the brain, from other cells and tissues, back into the blood to be carried to the kidneys and out the urine. But the hair picks it up as an excess. That's when you see the high. But then as the copper gets mobilized, copper's effect on the other electrolyte minerals also gets triggered in this cascade. As copper goes up, potassium goes down, soft tissue calcification occurs, building up calcium in the wrong places. And so you wind up with a shift in the calcium-potassium balance that was designated as the thyroid ratio by my mentors over 35 years ago. They recognized a high calcium-potassium as a hypothyroid. So that's what copper can trigger. That's what I mean by a cascade of changes. So zinc can trigger that whole cascade.
And the issue then is the relationship of all these trace elements, one with another, so that if you don't look at the entire picture and you just take a supplement willy-nilly, hey, I think I need a little bit of zinc because I've got some white spots on my fingernails.
Yeah.
The whole thing can turn to not good.
The mineral system is interrelated, but there are very delicate balances between the minerals. And one of the current things we're seeing is a lot of people who are taking a lot of vitamin D are also starting a similar cascade of changes in their mineral system to what happens with zinc triggering a detox of copper.
And what does that happen? What does it happen with the vitamin D excess?
Okay, and Dr. Watts wrote an article in his newsletter about this effect in 2008. He said vitamin D lowers potassium. And so I began to see this occurring in quite a number of my clients that I work with. But also, I took 4,000 or 5,000 IU of vitamin D back in 2010, October 2010. I had a nice balance of sodium and potassium, almost a perfect ratio. Within 3 months, my ratio increased tenfold because the vitamin D crashed my potassium from a high of 19, and the ideal potassium is 10. And I'm a fast metabolic type with high potassium. It crashed potassium from 19 all the way down to 1.
Wow.
And my sodium potassium ratio jumped from a near perfect 2.3 all the way up to 24.
So clinically, what does that mean then?
Clinically, that meant that my energy from thyroid activity dropped precipitously. But I was revved up and locked into an intense sympathetic dominant fight or flight condition. And with my problem with magnesium loss and deficiency, I knew I was in trouble. Sure enough, my magnesium crashed again. But that's how quickly a person's mineral system can change under certain conditions with certain kinds of nutrient inputs.
So with that vitamin D, you would have been exhausted energy-wise, but wrapped really tight.
Right.
And you would have been stretched like a doggone rubber band between the two
Yeah.
poles of the situation.
Yeah, and my wife saw that, well, deja vu. I'm back to where I was 30 years before.
Well, Rick, we
But
could
that's-
talk about this all day. I want to bring up the PDF that you've kindly put out. It's going to be at corebrainjournal.com, 026 download. And Rick has given us a PDF on the calcification of America. It's good for business. And Rick, could you talk a little bit about that whole business of calcification and what your opinion is about that and how we should consider it?
Well, I was strongly influenced not only by Dr. Watts and his partner, Dr. Eck, with the hair analysis, but Dr. Guy Abraham, an MD who was an OBGYN at UCLA. And back in '82, he wrote a brilliant article dealing with overcalcification that he was seeing in his OBGYN patients. And he recognized these women were becoming overcalcified, which also meant they had a significant magnesium deficiency. So I just elaborated on what I learned from Dr. Abraham's brilliant paper. And his paper is available at a website called Magwater, mgwater.com.
mgwater.com. And so the point was that they were actually collecting calcium with
in the wrong places.
Supplementation, and the whole situation was by taking the, I'm guessing where you were going with this, that they actually added too much calcium on and began actually accumulating.
Right, in the soft tissues, joints, and arteries, and slowing their thyroid. And as their energy dropped, they would begin to manifest with depression. And the mineral system, when I got into hair analysis over 30 years ago, here I'm a licensed psychologist in Illinois, a certified school psychologist, and I'm starting to use supplements and introducing this lab test into my psychology practice. And I'm saying to myself, am I starting to get close to crossing a line between psychology and medicine?
Interesting question.
It didn't take me long to realize no, because the minerals in a hair analysis relate to stress. And stress overwhelm is such a key psychological factor. The hair analysis is as much a psychological tool and psychiatric tool as it is a physiological tool.
Well, it's been interesting to me because working with Bill Walsh, you can see that all those trace elements directly influence the evolution of the neurotransmitters, how
Right.
they work on a synaptic level, whether there's an abundance or diminution of neurotransmitters. And then, as you were saying, the person becomes depressed, they become hyper, they become anxious. There are a variety of, and these problems don't respond straight up to psych medications. Because
No.
the psych medications are only collecting the chickens that are in the ranch. You know, if the neurotransmitters are too much, they're going to have a problem. If they're too few, they're going to have a problem, because that's what the psych meds are focused on, is
Right.
just the neurotransmitters alone.
Right. And the question is, what is affecting excess neurotransmitters and what is affecting insufficient neurotransmitters? And ultimately, you can trace it back to the minerals and the mineral system and stress.
Well, it's very interesting, Rick. We really are running out of time here, but I want to tell the listeners just to remember Rick Malter's, Dr. Rick Malter, The Strands of Health. In the show notes, I'm going to have plenty of notes of David Watts's book, Rick Malter's book, and for some reason, it looks like David Watts' book has gone out of publication. I was just looking at it on Amazon before.
Really?
Well, the lowest price was like $53 for a paperback. That didn't make any sense.
I still got my original hardcover that he published 20 years ago.
Yeah. So I think the thing that's really important about this, that there are other avenues that a person can pursue if they feel like they're a treatment failure, if they're taking all the traditional medications, and there are some things that you can measure. I mean, the issue that you've really raised for us very helpfully, Rick, is there are things you can specifically measure. What I really appreciate is, because I certainly don't know nearly as much as you and your colleagues do, but you can get that report and it will tell you where to go, and the ratios are where the rubber meets the road. I mean,
Right.
what the numbers are is one thing, but the ratios is the bottom line as far as I'm concerned.
Because the ratios are regulating thyroid, adrenal, blood sugar, stress. It's all there. Even infections.
Yeah, it's so interesting. So, well, listen, I'm going to thank you very much for taking the time down there in Cottonwood, Arizona, Rick. We really appreciate having a chance to talk to you. I've looked forward to talking to you for a long time. And, you know, we couldn't possibly cover all of this in a half an hour, but I think it's been intriguing. The nice thing about this fact that it's an audio recording is you can listen to it again.
Yeah.
You know, when you were saying a bunch of different things, and for the ordinary listener who isn't as attuned to this as you are, you can play it again and listen to it and get another thought about it. And the literature's there. We're going to have plenty of peer-reviewed references. Thank you for the ones that you sent me. We're going to have more peer-reviewed references on the show notes as well.
Yeah. The one thing I would like to close with people who are interested in learning more about the hair analysis, be patient with yourself. The hair analysis mineral system is very complex. It's not a one-time learning curve for most people. It's information that you have to study, and you really have to focus on, and you have to repeat. And then all of a sudden it clicks.
Well, it isn't a one-shot thing.
No,
It's a look at it as just the beginning. So
it's a
Rick,
brilliant system, but it's not easy to grasp the first time around.
absolutely. Sorry I interrupted. So tell us where listeners can get in contact with you and get more information about you, Rick.
Okay, my website is www.malterinstitute.org. And that'll
Malter Institute.
malterinstitute.org. That'll provide more information about the hair analysis and my articles on both psychology and on hair analysis and nutrition. And one of our key components in our psych approach is what we call the judge or the inner tyrant.
Take a moment to tell us about that before we close.
Okay.
That's a good point.
Okay. My early psych training was with Dr. Bruno Bettelheim at the University of Chicago, who is a Viennese psychoanalyst. And so all three of his courses that I took were Freudian, id, ego, superego. And I almost dropped out of psychology because I figured there's no way I can be an authentic psychologist without a Viennese accent.
felt that way myself in my own psychoanalytic training, I can tell you.
So anyway, my wife and I were fortunate. She was the OT, heading up the OT department in a general hospital psychiatric unit. And they brought in a clinical psychologist and his team to train the psychiatric unit staff. And that was Dr. John Cooper, a Northwestern PhD clinical psychologist. And he also dropped psychoanalytic theory because he learned about Gestalt and TA and real practical approaches. And he eventually came up with what he called the judge, which is essentially a psychological entity that develops around 8 to 10 years of age when people's intellect are at a very concrete level of thinking, either or, right or wrong, good or bad, black or white, healthy, sick, the either or level of thinking. And the judge also is into power and control issues. So the judge is always trying to dominate and control the person's inner child. And sets impossible standards. So just when you think you're going to achieve the expectation or the standard, the judge raises the bar, and your inner child is reaching and misses the bar because
and you're out the window again.
So and then
what's the mineral? Close with us on what the mineral implications are on that judge.
Oh, good question. The judge is closely related to stress. It develops out of the stresses of childhood. Criticism, punishment, and things like that. So the mineral pattern is a high sodium to a low potassium stress ratio. The higher that stress ratio goes, the more likely it's going to inflate that individual's own psychological judge. And they'll have problems with self-esteem, self-confidence, and all of those kinds of factors. Right. And they may get a feeling of a sense of threat or doom. When the judge...
I worked with a few people like that.
Oh, it's universal. And it's inherent to human nature because it's so closely related to the stress response. And that's where the hair analysis sodium-potassium ratio meets the psychological stress response, which inflates the judge. And anything that relaxes a person, magnesium is an anti-judge, anti-stress mineral. My wife teaches yoga, deep breathing, yoga, slowing down.
Well, I think in closing, Rick, there's one other thing that's true, and that there is not a medication for that.
No.
That's beyond medication. That's onto personality, and personality is run on a deeper level.
Right. And what we have found, and the judge is an entity that can be imaged and visualized. It's like a little icon in the person's brain. And under stress, it goes from an icon to full maximum on their brain's computer screen. And when you relax, then you shrink it down to an icon. That's why we call our book Shrinking the Judge.
Shrink the Judge. Yeah, I think that judge you just described had horns and big teeth.
Yeah.
Hey, Rick, we got to run. Thank you so much again for talking to us.
Charles,
we look forward to talking to you again sometime in the future.
Let's stay in touch.
Yeah, have a good one, buddy.
You too.
See ya.
Bye-bye.
Bye-bye now.